Good morning, everybody. Happy Monday. I am tuning in from Ability's first and probably last snow day working from home. So I've got my little buddy, Charlie, who won't leave me alone, joining us on the videos today. So what we're going to be discussing in the office this week is vitamin D. And this is a topic that I have shared with you guys in the past, but there's a few more things that we're going to be covering over the course of the next 5 days here. Let's look at this graph together. So basically what this graph represents is how many days out of the month we get sun through the course of the year, and averaging how many hours throughout those days we actually have sun exposure. So the overall takeaway here is that basically from the months of September through April, we get barely any sun here in Columbus. And this is a graph specifically for Columbus. With an all-time low around December and January where we get maybe 4 days out of the month with sunshine. And out of those days, we get roughly 3 to 4 hours of sun if we're lucky. So the whole reason why we get vitamin D deficiency, and more so in the northern states, is because of this lack of sunlight. And to be honest with you, there aren't many food-rich substances that have vitamin D. And then you add our processed diet on top of all of that, and that really eliminates our chances of getting any vitamin D through our diets here. So the best way for us to get it is through the sun. Now, why vitamin D is important for us to preach and discuss within our offices is because it actually has an integral role in almost every bodily function, whether it comes down to brain health, musculoskeletal health, neurological health, gut health, hormone health, and then you add the cell cycle. So it has a lot to do with just cell mediation for every tissue in the body. So needless to say, we're finally in this position where there has been enough research done on vitamin D and still a lot more being conducted on how important it is for our health. In fact, they have a lot of research starting to show that a lot of breast cancer, colon cancer, prostate cancers, cardiovascular disease, diabetes, hormone dysregulation, all of these things could be prevented if we just take a more proactive stance with our vitamin D levels throughout our lifetime. All right, our next question is, how much vitamin D should you give somebody? Now, if we're talking winter months up here in Columbus and northern states where 99% of us are vitamin D deficient during this time, it is safe to recommend at least 6,000 IUs of vitamin D per day. Now, for the type of vitamin D that we sell here, that is 3 droplets underneath the tongue, and you hold that there for 30 seconds to a minute. Now, in the summertime, it's important for these people to decrease their intake to around 4,000 IUs a day. That's what I would recommend as a wellness type of dosage. But I have also recommended to patients, especially when they're sick, they're fighting something off, or they do feel a little bit more depressed, a little more moody, I will recommend that they bump that up to 10,000 IUs for a week, but I don't suggest anybody to stay on that type of dosage for longer than a week. Now, lastly, any contraindications to vitamin D? To be truthful, there aren't that many. The only patients you have to watch out for are those who are seeking some sort of intervention for kidney failure or who have been diagnosed with sarcoidosis. And the reason why that is because vitamin D plays an integral role with balancing calcium levels within the blood for bone growth. All right, guys, I know that was a lot of information for a Monday. So take everything that we just spoke about today, utilize it throughout the week, and I'll see you guys again tomorrow. Thanks.